All right, today we're talking about the best exercises for osteoporosis. I've done some work on this before, looking at the LIFTMOR trial where patients with osteoporosis did an 8-month workout that was only 30 minutes, 2 times a week, and they saw up to a 12% increase in bone density. So pretty amazing results in only a short amount of time, less than a year, and only 30 minutes twice a week. So the main complaint that I got from a lot of my viewers was that with a bad back, with a bad hip, with a bad knee, it's really hard to do some of these exercises. So I wanted to come back and revisit these exercises for building bone, but do it with an emphasis on what tweaks you can make to get the same benefits without having to worsen a ill-performing body part and to work around those areas as you build them back up so that you've got that full mobility, full power, and you're able to get the most out of these workouts. And today I'm joined by 2 special guests. First is William, who's volunteered to be our test dummy for this shoot, and he's going to go through the workouts with us. He works out with me at my CrossFit gym. He's a great athlete, and he's going to show us how he's worked through some of these, and we're going to give him some pointers and talk about some of these focus areas that a lot of us face. And then I've got the esteemed colleague of mine, Dr. Lucius Pomerantz. He's an orthopedic surgeon and the host of his own YouTube channel, Cut to the Bone. Lucius, you want to tell us anything about you and your channel?
As an orthopedic surgeon, our bones are absolutely crucial to our function, and we all know that they start losing strength over time, and so moving, putting forces through them, all of that keep us going. And yeah, my channel is to encourage people to keep moving.
All right, now we're going to go over the 4 exercises of the LIFTMOR trial. Those are the squat, deadlift, shoulder press, and the jumping pull-up. And William's going to demonstrate them, and then Lucius and I are going to talk about how you can do these exercises safely and effectively, as well as how to modify them in order to get the most out of your workout, no matter what your limitation might be.
So William here, perfect, ideal candidate for a person who's trying to get active, who's lived a pretty active life, but wants to keep going. Mm-hmm. Tell me a little bit about what brought you here and what you're trying to do.
Well, so I retired a couple years ago, and I'm 67.
Looking great.
Yeah, thank you very much. And I'd kind of backed away. I surf a lot, but I had backed away from that. You know, I've had a little bit of issues with my shoulders, some in my, my hips and one of my knees. And so just been kind of watching it out, seeing what's going to be the best thing for me. My knee is feeling, it was pretty rough for about 6 weeks, but now it's starting to feel a lot better.
Okay.
I do wear knee braces, just to make sure I'm not, hurting it.
Okay. And the shoulder and the back, you're making it happen.
Yes. Shoulder is my weakest link,
okay.
Definitely.
All right. Well, we'll have some stuff that hopefully will help you work around
Awesome.
that as we go forward.
Awesome.
All right, so now we're going to get into the squat, and William's going to demonstrate first an air squat, which is going to be with no weight at all, just what we can do with our own body weight. And then we're going to talk about how to add some weight if you don't want to keep a barbell over the top of your head. And then we're going to talk about the modifications that you can do around bad back, hips, or knees. All right, so William, why don't we go with an air squat? Okay, looking good. So William's a trained athlete. He's doing a great job. His heels are lined up right under his hips, which is a great place to be, and the toes are pointed out about 30 degrees. And then as he comes down, his knees are going to track over his toes, but they're not going to go beyond his toes. So we want to make sure the knee is in alignment with the leg and the foot so that we're not bowing the knee in or out, putting unnecessary strain on the knee joint.
And certainly the knees and hips and lower back are stressed by doing something like a squat. So having those fundamental position of your knee over your toes, your shoulders aligned, but also engaging that core, having the glutes firing, the abs firing, try to imagine sucking that belly button in and being tight so you're not wobbling and you're staying centered.
So now let's try this again with weight. And what we brought today was a kettlebell. You can really use anything for this. A bag of rice. Lucius' favorite was?
Oh, well, my child,
yeah, right.
Grandchild. Those are great things to lift.
Don't drop any children. So we're gonna grab the weight, and it really doesn't matter how you're holding it, but William's gonna show us a couple of different positions and show us what a weighted squat looks like if you're not comfortable carrying a barbell over the back of your shoulders. Excellent. So as you can see, William's letting the dead weight of the kettlebell just hang. No need to be lifting it up or raising it or any of that. We don't want to put any stress on the shoulders. This is going to load the axial skeleton and the lower extremities, building that femur bone, building the hips, and building the spine. And now we're doing what's called a goblet squat, where he's engaging his core and some of that upper body musculature. And Lucius, what do you think? I mean, are we building more bone with this, or is this more of an overall fitness move that's going to build more strength and core strength? You know, what's the benefit to holding it up like that?
I think it's certainly working more of the core and the upper body strength. I think the forces going through the skeleton are going to be similar. The same amount of bone growth is going to be similar, but this certainly is a higher level of fitness, getting that weight up there, holding it.
Excellent. Now, if we were talking about building bone, what do you think? If William is really comfortable with this amount of weight, should the next move be to change the position or to increase the weight?
Well, I think to build bone, if that being the major goal, and it should be, it's starting to go up in weight. Obviously, staying safe with the amount of reps and not hurting yourself. But when you start going up in weight, the bone sees more force, and that's where your bone's going to remodel and be stronger.
So this is a good time to talk about what the resistance level was in the LIFTMOR trial. So if we were to give William the heaviest kettlebell that he could lift just once, that if he put it down, he could not lift it a second time, that would be his 1 rep max. And in the LIFTMOR trial, we were looking at 80 to 85% of that 1 rep max. And we were gonna lift that 5 times, take a rest, do it 5 more times, take a rest, and do 5 sets of 5 reps at 80 to 85% of that 1 repetition max. So if William can lift a 100-pound kettlebell, we'd be doing 80 pounds today. So we're just using a demonstration weight, but that's how you should be thinking about it at home. Play with different weights. Figure out what's the heaviest you can comfortably lift. Don't hurt yourself with that one lift, but pick a weight that you're comfortable with and then back it up so that you can do 5 reps with some pretty heavy resistance. Any thoughts on this one?
We're working on gradual progressions. We're not trying to set a personal record on the first day. Ease into it, feel how you're feeling when you're doing it, feel how you feel the next day, and build on it.
So let's talk about that 2-month warm-up period that we were discussing before the video.
Yeah, so the LIFTMOR study, they're very specific in saying that the patients they had in the higher interval resistance training branch of the study, they had 2 months of practice and building up their strength before they really started doing these exercises. So you got to give yourself time to get that core strength, the basics, technique, and then going for it.
Yeah, so those first 2 months are really about learning the movements and getting comfortable, and then by the time you're done with those 2 months, you should be able to safely figure out what that 1 rep max is, and then that 80% of is what you're doing for the next 6 months. And the interesting thing about this one, I really thought, was that you're really getting that bone density improvement over what's really 6 months of the heavy weight training, because 2 months was kind of your warm-up period, right?
Exactly, yeah. I mean, with bones, with our skeleton, it takes time. One, to notice it radiographically, but it's just something that's going to remodel slowly. We're not trying to make things happen overnight. But 6 months is not that long in the big picture.
Yep.
And they did show some bone growth, bone regeneration, which is pretty striking without much time and effort if you really think about it.
Yeah, the range of increase in bone density was up to 12% in this trial, so pretty impressive. But let's talk about what happens if you can't do the squat that William just did. So I'm going to bring in a couple of props, and then we're going to talk about how to work around the back, the hips, and the knees. So now let's take a look at what this looks like if doing the squat with the kettlebell is a challenge because of your mobility, because you're getting pain with the joints. And to do this, we brought a box in with some weights on top. And the idea is to get a chair, use some books, find something, a stool that you're comfortable squatting down to, and get it to the height where you're pain-free and you're able to do this with the right form. And then as we get better, we're gonna lower the height of that as you improve your strength and mobility. And like Dr. Pomerantz was saying, this could take weeks to months. So you don't want to rush it, but when you've got a few sets down, a few days down, even a few weeks down, and you're feeling really good about it, then we're going to increase the depth of that squat. So William, let's just see how this looks with the box. So what he's doing is he's not going to sit down all the way and then pop up again, which is going to deload and reload his joints and his muscles. Instead, it's going to be kind of a touch and go. He's going to touch to the box and then stand up. And why don't we do it with the kettlebell? And this will keep the loading on the whole time as we're doing the movement. So he feels it under his buttocks, he pops right back up again. And of course, if you feel like you need that, you're not going to be able to get back up again, the box is there for you. And then let's say we're doing great in month 1 or month 2, we pull this off and we're going to go lower. And you can see we can just keep going lower as time goes on and eventually end up with either a very low support or no support. And then what do you think about, our friends and athletes with osteoarthritis of the knees, hip pain, piriformis syndrome? What are the kind of, thoughts on how to get this done successfully?
Some of it is being willing to experiment a little bit, changing things up, changing how you're holding the weight, changing where the weight is, and changing how far you dip. Might all kind of have to be worked with in a workshop to figure out what's going to work best for you. The main thing is you're remaining within proper form. If you let your ego take control or you get afraid of the pain, you might get thrown off and be susceptible to injury. So staying within a framework, having a box behind you is a great way at a higher weight, and gradually build up or build down to that deeper form.
Yeah, and I think you said a couple of things that were interesting there for sure. One was that, within boundaries, and I think if you have access to a trainer or somebody who really knows their stuff that can kind of supervise or spot you or give you some of the guidance like we're giving William, that's really great. So if you can use that resource for a short amount of time, that's fantastic. And the other thing you mentioned was these modifications. And I'm assuming for our viewer's sake that you're talking about avoiding pain, right? So you feel the hip and we're gonna kind of just see if we can reposition the weight or reposition our feet in order to reduce the pain without going crazy on going outside the boundaries of what would be good form for the exercise, right?
Exactly. It could be small changes. Instead of a 30-degree angle of our toes, maybe it goes a little bit further out. Maybe your legs are a little wider. Maybe you aren't dipping quite down as low. Maybe you have to sit back a little bit further. Find out what works. As long as you're doing the force, getting the forces to go through your muscles, it's going to be doing what we want it to do.
All right, let's move on to the deadlift. And again, we're talking about doing deadlift with about 80% of our 1 rep max. And for this, you can do this with a barbell, and I've shot that video before. I'll leave the links in the description. William's going to do it with the dumbbell again, and again, we can use any weight for this. So feel free to get creative at home. Now, this is basically a fancy way of picking something up off the floor, and we'll show you some of the pointers in terms of form as William goes through the movement. So go ahead and give us a few reps there, William. So one of the most important things with this is not overloading the back. So actually, if we leave it at the bottom this time around and just stay there for a minute and show me this. So what I like to do is put my hand on someone's back and have them kind of roll their back around my hand. It kind of forces you to kind of, curl the spine in that direction. And then if we look at the opposite of what that looks like, if you round your back, so that's what we don't want to be seeing is you're putting a lot of stress on the muscles of the spine as well as on the intervertebral discs. Lucius, any pointers on this one?
Yeah, I mean, having the body aligned is going to be taking the most weird forces, uneven forces off the spine. And you're hanging down in that squat for a while. You're fit, you're good. But in general, I think this is a good base to build from.
Yeah, and other pointers on this while William goes through the motion is we're going to keep the toes pointed straight ahead. We're going to keep the knees over the toes, and we're going to squat down. I like to tell I'd like to tell people, kind of think about sending your butt back like you're going to close a car door with your butt. So that way you're not really squatting down. You're kind of sending your hips back as you go down. But the hardest thing about this is getting the mobility to go all the way down to the floor. And we've got a modification here for that.
Yeah, so sometimes not having the weight go all the way to the ground. having a stool or a bench or a table where the weight's not going all the way down can take some of the stresses off, help you with that range of motion limitation while you're building your strength and range of motion.
All right, so let's move on to the next exercise, which is going to be the shoulder press. All right, so moving on to the shoulder press, this can be done with a barbell or with dumbbells. William's just going to show us what a shoulder press looks like with the dumbbells. Starting right at the shoulder height, going directly overhead. Very simple, not a whole lot of complexity to this unless you have problems with the shoulders or the elbows or the wrists.
And certainly those come up, and it can be very hard to do these overhead shoulder presses when your shoulders are hurting, when the rotator cuff's not where it needs to be, or you got shoulder arthritis. And that's where we start having to figure out some modifications. Maybe you're not looking to fully lock out those joints. Maybe it's going to be just a half, and you hold it a little bit longer. And then you'll let it down. While you're doing this, also want to add a little emphasis of positioning. A lot of it's in your shoulder blades, getting those shoulder blades down and back, and almost kind of like pinching something between your shoulder blades. And that opens things up for your rotator cuff and keeps it from getting pinched, and it helps open it up and get the weight above your head a little easier. What I also like about the independent hands, where it's not a bar, it's dumbbells or something else, is that each hand or shoulder can do something slightly different. Often someone's got one bad shoulder. You can modify whatever you need to do on one side and do the other. Another thing that's nice too is you can just do one shoulder. If that's all you got, do one shoulder. And then the final variation is essentially just holding the weights. You can do shrugs with it. If you cannot get those arms up, and that happens with some patients, at least holding those weights, making your core stabilize, and shrugging up, that's getting something to go through your skeleton and help your bone get stronger.
Yeah, anything that puts the strain on the spine and the hips and the legs is going to be building that bone, right? So this is just one more way of doing it. And we can even sit to do this if standing is a challenge. We're still loading the axial spine, but we're just not getting that lower body hit. For most of us, I think the shoulder weights are going to be lighter than what we can do with the deadlift, so maybe the impact is less with this, right?
For sure. Yeah, you're definitely working with less weight with the shoulders, but we're not trying to set any personal records on that first day. Gradual strength increases, building up over time, getting your technique right, figuring out what works for you. Those are the keys.
Yeah, and if you feel the pain and you can't work around it, don't try to push through it. Talk to your doctor, talk to your physical therapist. Figure this one out before you go pushing through. We don't want to make anything worse. All right, so should we move on to jumping pull-ups? Excellent. So now we're moving on to the jumping pull-up, which William's going to show for us. And the idea with this one is not to build your upper body strength like a regular pull-up. We're not looking to build the back muscles and the biceps. We're looking to load the axial skeleton, and this is high impact. So we think about resistance training and high impact. This is not really the resistance, this is high impact. So we really want to hit the ground in a safe, controlled manner that still kind of sends a shock through the spine, and it's going to start to generate that bone growth. So we've got a few boxes set up, and whether you have an adjustable bar or you've got something to stand on, the idea is to get to the right height so that you can safely get your chin to clear the bar. And I like to tell people that you really want to have the bar kind of above the chin so that you got somewhere to jump to, but not so far above your chin that it's a lot of work to get your body up there. So we're going to start low, and then we're going to work our way through the boxes and see kind of where William is comfortable doing his jumping pull-ups. So let's demonstrate a few of these and let's see how it goes. So in this box, we can see that William has his nose or his upper lip in line with the bar. So he's only jumping a couple of inches, and it seems like he's pretty comfortable. And you can hear the impact when his feet hit the box, but he's not bending his knees too much. So he's not going to lock out his knees. He wants to make sure that he's landing on a bent knee, but not to absorb too much of that shock. Lucius, any thoughts on this one?
No, I think it's great, and it's part of this graduated process that we'll be talking about. So.
All right, so let's see what happens with the next one. So now we've got the bar really at the level of your forehead. So this would be a next level up, maybe on your second, third, fourth, fifth week. And what you'll see is that William's using his arms to pull his chin up over the bar, but he's not hanging out too much up there, right? So he's going to let go of the resistance, not let go of the bar, as soon as his chin clears, and he's not going to be working too much on that upper body strength. So you're using your legs and your arms to get your chin up in order to get that impact on the bottom. And then let's just, for fun, let's do one more there.
William's got it.
William's got it. I believe it. As soon as the bar is over his head, so this is going to be a serious, and boom, there it goes. This is what after 3 months in the gym looks like, right? Yeah. We got month 1, month 2, and month 3. That's the way to do it. All right, excellent. So I think one of the questions that I can imagine people thinking is, what if, you know, I've got a bad rotator cuff, or what if I have a vertebral fracture, right? So this, I mean, I'm talking about sending a vibrational shock through the spine. I'd be pretty worried if I had a...
Totally.
Yeah. So what do you think?
So to address the spine issues first, obviously if you have a healing fracture that's ongoing, you're going to be limiting your exercise, get clearance from your spine doctor before you start doing anything with impact. But say you've had it, you've recovered, it is okay to start putting some forces through your spine. It might help prevent another fracture from happening if you start doing it and doing it the right way. So again, you're not locking your knees out, you're not slamming, but you're still letting some forces come up through the legs. And you know, 4 or 5 inches fall is very reasonable as long as your legs are working and you're engaging your core, protecting the spine with your core. Your spine will be okay. Now, there are variations for those of you who can't get your arms up to the bar. If those of you with shoulder pain, could be a bar in front of you where you push yourself up off the ground.
Great idea.
If you're on stairs, you go up 1 step and you just come down a little bit. Going down the stairs in a way that's controlled, keeping your core engaged, but letting your body kind of land a little bit, still gets the same forces going through your legs into your spine that we're trying to do here.
Yeah, so you made a really good point with that step and, you know, going from a small step down to the ground rather than jumping up and down. And I heard you say something earlier to William about how stairs has a multiplier effect.
Yeah, so just as a bonus information, arthritic joints, hips, knees, cause significant disability, and the amount of forces that go through our knee joints when we're going up and down stairs is 4 times our body weight. So if you can imagine, if you lose just 10 pounds, for every step on stairs, you're seeing 40 pounds less through your knee joint. And if you're trying to do 1,000, 5,000, 10,000 steps a day, you can do the math. The amount of forces that go through your joint are way less just by losing a little bit of weight. So weight loss is huge.
Exponential benefits, right?
Totally.
Now, you know, if I'm not worried about, you know, having weight to lose, but I'm thinking about building bone, what do you think about, you know, taking a weight vest or another, you know, way to carry weight and doing downstairs as a way to, because I know going upstairs with weight is, that's a real challenge, but maybe we're getting that benefit with carrying weight downstairs when it comes to bone growth.
Certainly, if there's limitations in your arm or the capacity or the logistics of using a pull-up bar are too much, certainly you can add a little weight and go downstairs. That gets those forces going through your muscles and your bones and helps get your skeleton stronger.
Yeah, I mean, I think I'm going to use this one because if I carry 10 pounds downstairs, I get to tell people I carried a 40-pound load. So I'm going to get bragging rights for this one.
That's what your knees saw. And
yeah.
Hey, rucking, it's popular, but it's a lot of this. You're putting a little bit of weight on you and you're not running, you're just walking. Yep. Seeing those elevation changes, slapping the ground, getting the forces going through your skeleton, good for your body.
Yeah, and we're mentioning the ruck, which is a fancy way of a weighted backpack, and my wife has a weight vest. You and I were talking earlier about weight vests and weight belts, but really anything that you can do to safely increase the load on the upper body, whether you're going for a walk or going up and down stairs, or we're doing some of the exercises we're doing here, the squats and really the deadlift, some of these things, if you're wearing a weight vest, you're maximizing that, and it could be a substitute for or in addition to the weight that you're holding, right?
It can be an augment and an adjustment. If holding the weights in a certain way is going to hurt your arms, or if you got to shift weight off one leg, holding the weight onto your body in the form of a vest can be a great modification.
Yeah. Awesome. All right, so let's let William down off his perch and we'll wrap up. So William, you were telling us earlier that you're only 3 months into the gym. Before that, you really hadn't spent much time in the gym. How did you feel about these 4 movements and working around what might still be a janky shoulder, hip, or knee? You know, did you feel like there were areas on this that were, you know, surprisingly good or bad? What's your experience?
Well, I think for me, they're really, really good because one, it takes the stress off the body. When I first came here, you know, I would come in and, you know, again, with the weight, I would use too much weight. I found that I was having pain here, having pain there. Just yesterday I did pull-ups, but I'd hang, lower myself down. I had the pain in the right arm and the knees. So with the squatting, again, too much weight, my knee would bother me. Today, you know, there was no pressure, no nothing anywhere with what I was doing. So I felt really comfortable with it.
And you got a good little sweat going too.
Yeah.
So.
Oh yeah, look at that. you and I are sweating a bit. Yeah. Any last thoughts?
Oh, it just, you know, our health is a long game, you know, and whenever you start is the right time, and you got to keep going, and you got to figure out ways to keep going. And so your story is certainly inspirational. You're in it, you're doing it, you're figuring it out. So it's exciting.
Love it.
Yeah. Yeah, so really grateful to Dr. Pomerantz to bring his decades of experience as an orthopedic surgeon to us, and William for being a good-humored model for us, and you did a great job up on the exercises. So really,
Thank you very much.
Yeah.
and I'm going to leave links in the description to more information you can get on the workouts, more free resources for building bone, osteoporosis. We'll talk about supplements, diet, all the rest of it. It's really a holistic package, right? Building bone. So we'll talk about all of it. Check the description for that. I'll also leave links to Dr. Pomerantz's YouTube channel, Cut to the Bone, and stay tuned for more great content. Thanks for watching.
Cool.
That's awesome. Cool. Nice job.
Thank you very much.